Welcome everyone to the Adrenal Fatigue podcast. Danielle and I are so excited. We're here today with a very special guest, Dr. Holly German. Holly German, she's one of our in-house naturopathic doctors at the Adrenal Recovery Collective. Welcome, Dr. Holly. Thanks for being here.
Hi, thanks. Thanks for having me.
Awesome. We're so excited because today we wanted to talk about a very important topic. This is a symptom that is fairly common with our community and our clients with adrenal and hormonal issues. And this is shortness of breath, or often referred to as air hunger, or dyspnea, I believe is how they say it in the medical community. So obviously we need air to breathe, right? So when we have this experience, if you're experiencing this out there, it can be scary. So I think it's really important to have this conversation. So we wanted to sort of break it down, give you some clarity, give you some direction as to how you might address this and get to the root, and most importantly, some tips and next steps for you today. So should we dive in?
Yeah, let's do it.
Okay.
Yeah, and Dr. Holly, we can't wait to have this conversation with you. I think, like Angela said, it's going to be so helpful to just bring some clarity to so many of you guys out there who are struggling with this symptom all too regularly. So I think a good place to start is why is this experience with air hunger so common, or common when you struggle with adrenal fatigue or hormonal issues, hormonal imbalances, I should say?
Yeah, that's a great question. So I think it's a few different things that can play into it. And it is one of those challenges that it can kind of perpetuate itself. So oftentimes people will notice as other symptoms worsen, the air hunger symptom also gets worse. So one thing to kind of look at is to see it as part of the bigger picture of symptoms. And that will help when we're trying to figure out if there are potentially other causes that are contributing to it as well. But I think the main way it connects with adrenal or hypothalamic pituitary axis issues in the bigger picture is in how our breath and our lung function is really tied in with our nervous system and our survival response. So your community probably knows more than the average person now about the nervous system and the sort of the fight or flight side of the nervous system, and then the rest and digest or parasympathetic side versus the sympathetic side. So oftentimes in adrenal fatigue, you'll hear people say they have, they can be exhausted, but also wired. And so they're always sort of on this energy roller coaster. And some people are at one or the other extreme of that. But I think air hunger comes into play there because your whole body physiology is responding to the chemicals, which are hormones and neurotransmitters in your system that are a little out of balance. And so your body's energy basically is going elsewhere. And so you'll have some shortness of breath when cortisol is elevated, for example. So in the more wired states of adrenal fatigue, that can kind of put someone into that survival state biochemically. And so that can cause the shortness of breath symptom too. Does that kind of make sense?
Yeah, I think it's really nice to put that connection together with the nervous system. I mean, when I think of air hunger and stress, I often the image I get in my mind is panic attacks, right? When you think of grabbing the paper bag and hyperventilating, and you can really see so clearly how a really emotional thing is going on, and it's so connected to your breath, and how breathing is such a focus when it comes to calming down in those situations. So on that note, what could be some of the underlying issues with shortness of breath or air hunger, if people want to rule anything out?
Yeah. So a lot of that is, I think, well illustrated if you just think about the structure of your lungs and your respiratory system. So the respiratory system is your lungs, which are basically under your rib cage. That's where they live. And then your trachea, and then all the connective tissue between your mouth and your lungs. So sometimes air hunger can be caused just by structural things, right? So it could be, I think most of us maybe have experienced like having a rib out or something like that in the structure, where when you try to take a deep breath, it feels like something's kind of poking you. I know that's happened to me. It's so uncomfortable. And so you're going to be prone to breathing a lot more shallowly when that's part of it. Other structural things are more internal and harder to think about if you've never experienced it, but like people with asthma, for example, they just can't get air out, and so new oxygenated air can't come in. And so sometimes it's just simply respiratory stuff. So to rule that out, I think the best start for people would be just going even to a primary care and getting a lung exam. I think if air hunger is a really common symptom and it's happening outside of other maybe anxiety related symptoms, then that would be a good place to go to see if maybe there's something going on structurally with the actual respiratory system. Heart health plays a role with dyspnea or air hunger too. And so in that same probably primary care doctor visit, you could also get a cardiovascular exam, get blood pressure taken, all of that stuff that it's pretty basic. And maybe now it's not so easy to get like a regular physical exam with a doctor, but whenever that is a convenient thing to do, I always suggest people do that at least annually. A lot of people have kind of fallen off of just doing regular MD doctor visits, and that physical exam can actually tell us a lot of information. So that's a good place to start. And then the other thing is some blood work can give you some information about that. So some other things that can cause air hunger are some imbalances in the blood chemistry. So one that a lot of people know about is anemia. So anemia can be caused by iron deficiency, but also some B vitamin deficiencies can contribute to it as well. And those nutrients, literally, they're required to get oxygen into the red blood cells and then to get blood flow and oxygen to your brain. And so shortness of breath can be a common symptom of that because there's just not adequate oxygenation through all of your tissues. And your body kind of goes into panic mode because the brain really needs oxygen. So basic blood work can show that. The other thing is to look at blood chemistry, like things like CO2 and other electrolytes that can be out of balance more in cases of chronic air hunger where there's a bigger underlying, usually pulmonary condition. But all that is really important for just foundational stuff. And really with a lot of adrenal fatigue sufferers, because adrenal or HPA axis dysfunction is not talked about a lot in the mainstream medical community, a lot of people will come to me and they haven't had a conventional medical workup because for a variety of reasons, but I often will say that's a good place to start. Even if it's not a conversation about your adrenals or about the HPA axis, or maybe there's not a lot of answers about fatigue when it's not easily findable through the mainstream means, it's still a really good way to start and get a baseline for a workup.
Yeah, I think that's really important. So if any of you out there listening are struggling with air hunger, these are some great tips. So make sure your foundations are checked out. You can do that with your doctor. And I think that the one thing I would maybe add, and maybe it's really obvious, is like what if you're sick, right? Like it could be like infections or a virus or something like that, right?
Sure. Yeah, there's a lot of common colds and flus and things like that will have lingering coughs and respiratory symptoms for even months afterwards. And it's a good idea to get that checked out. But you're right, that's a common cause of air hunger too.
Like maybe that's a little bit more obvious, but just putting it out there because you're right, they can linger.
Mm-hmm. I guess another really obvious one is just fitness, right? So sometimes if you're trying some kind of new fitness routine and your cardiovascular system and your pulmonary system hasn't adapted to that, then that can cause initially some shortness of breath. So good idea to, again, check heart rate and things like that to make sure you're in target heart rate zone, which is an easy number to find online. But yeah.
That's good to bring up, especially for our fatigued community, who many of which maybe aren't exercising as much, especially during this weird year where we've all been inside a bit more. So I think that's a really good point to just shine a light on.
I was just thinking it's really nice to sort of be able to think about the different things that you could be ruling out here. So I really appreciate it's like kind of a nice list, whether it's is the shortness of breath from asthma? Is there something you need to get checked out there? Is it a cardiac issue? Is it anxiety? And I think it's important for us to kind of make a list of what you just shared and kind of go down the list and with your doctor and just doing a personal evaluation inventory for yourself to really kind of start to see what the answer might be for you. Yeah. So that was really helpful.
Good. I think one more thing that I should mention, because this probably comes up a lot in this community, is just how hormones can play a role with the breath.
Yes.
And so oftentimes during big hormonal shifts, whether it's, really big ones like pregnancy or postpartum, perimenopause or menopause, but even PMS. So sometimes I love when I do a lot of hormone stuff, right? So I love when I have female patients who are really good about tracking cycles, and you can kind of start seeing maybe more nuances with symptoms. And so maybe the air hunger symptom comes up more in the luteal phase of the cycle, which would be like when PMS happens, right? But it can be for up to 2 weeks before actually the first day of bleeding, and the whole hormonal picture during that 2-week period is very different than the 2-week period in the first phase of the cycle. So looking for stuff like that too, and then thinking about maybe there's beyond just the adrenal hormones, maybe there's a bigger hormonal component there as well with the female or sex hormones. It happens in men too, but cyclical is different then.
Yeah, that's great to have awareness around. Thanks for bringing that one up. So Dr. Holly, what would be some recommendations or first steps that you would say when it comes to addressing this?
I mean, I think the first thing to look at is your own kind of timeline. So thinking about when it comes up, is there some kind of pattern, either on a bigger picture, like monthly, or on a daily, is it on waking or only at night, kind of looking more at just assessing for yourself. I think probably with most of this community, it's more related to the hormonal and mental emotional piece, just under the umbrella of adrenal and hypothalamic pituitary stuff. And so thinking about how it crops up in relation to frequency, intensity, duration, things like that. So when it does happen, how long does it occur for, right? Is it just for a few breath cycles? Is it a couple hours? Is it maybe before or after eating? Like, could it be that perhaps your blood sugar is low, and so then your cortisol rises and your body goes into a stress response, and that's contributing to it. So a lot of it is just getting good at sort of tuning into your own patterns. And then, like I said, I do think, having a regular medical workup to rule out potentially more concerning causes could be helpful as well, and getting some blood work done. I'm a big proponent of getting regular checkups and blood work.
Yeah, this is an important piece, and I love that, just a personal assessment. And when it's happening, that timeline piece, I feel like is so important. And I'll share a story for a minute. So when I was postpartum with my daughter, I had this come up. This is a big symptom for me, and the shortness of breath. And for many of you probably know, it kind of shows up sometimes even as like, there's like a lot of yawning maybe sometimes, and sighing. You're just trying to get that full breath. And like I said, it can be scary. And actually I actually ended up going to the ER one time for it because it was scary. So I know some of you, I've actually seen many stories come through for people in our communities where this has happened. And so I just want to share that, because I think it's important that we know that this is such an important conversation to have, so that we can be aware of the different pieces at play, and also being aware that it could be anxiety. So when I went, my doctor told me there's nothing wrong, and I got all the tests, and that alone helped me feel safe, a little bit more safe in my body, and feel like it wasn't a cardiac thing. It wasn't asthma. It was some anxiety and maybe some fluctuation of hormones, and that helps me cope a little bit better. So I think just that alone is an important piece to. We always feel better, right, when we have sort of gotten a test result back and it's negative, and we know, okay, that's one less thing I have to worry about, right? Yep. And that comfort, that can be a lot better, especially if anxiety is one of the triggers too for shortness of breath. So that you were talking about this, we don't want the perpetuation.
Yeah, it certainly would give you peace of mind, wouldn't it? But also it can shine a light on your tendencies if you tend to get this a lot, but you know that your bill of health is clean. Like you might know that your tendency goes more towards anxiety, which then could be maybe a great segue into what we can do about that when it comes to like maybe a breath, like breathing exercises or lifestyle things that we can do in the moment to just kind of help calm that down and just calm our bodies down and catch our breath.
Yeah,
absolutely.
I think that's great. Yeah, I love when, you know, helping patients kind of tune into more subtle signs of anxiety. I find a lot of people don't necessarily relate to having anxiety, but then when you go down, you know, let's say everything checks out health-wise, and you go down physical symptoms of anxiety, maybe there's actually a lot going on there. And so I think this is one of those symptoms where it can be kind of a call to sort of tune in and see, you know, what else is happening. I think oftentimes it is accompanied by heart racing, maybe sweating or feeling clammy, you know, all of those symptoms that can happen when anxiety is higher. And I think oftentimes when that happens, people start to look, you know, outward and think, well, I don't have any reason to be anxiety. I'm just, you know, laying in my bed or whatever else it is. But the biochemical hormones that can make us feel anxious are part of what we're trying to help people address here, right? So I think it's important to acknowledge it as a symptom of anxiety when everything else has been rolled out.
I love that. And I think we talk about this a lot in our community, but this idea of new normal, or even just our own normal, and what that actually, we have all these stimulus from the outside coming in, and sometimes we think of them as normal, but you know, if you have all these little things coming at you all day long, and they are your normal, it doesn't mean they are normal, and if that makes sense. And so we need to start to kind of, instead of pointing the finger outward, just sort of looking inside and seeing what might be triggering this for you.
Yeah.
So
and when we say normal, we mean like your baseline, right? Like the baseline of how you feel. Right? So like if you're always struggling with this, or you're struggling with certain symptoms, then they become normalized in your own world. So just wanted to clarify that.
A lot of people that I've talked to kind of realize, like, you know, one of the things I'll do in trying to encourage a self-assessment is say, you know, how much of your day do you spend feeling frazzled? Like, look at those times that you feel that way. And oftentimes sometimes it's really clear. Like, I know even for me, I would say in the morning, try to get out the door. You know, I have 2 kids, like trying to get everywhere where they need to be on time is a time when I know if I'm not paying attention, I can easily get frazzled. And then on the other end of it, like the bookends of the day, right? It's getting dinner going, getting everyone transitioning home. But a lot of times it's way more than that. You know, for some people, sometimes, you know, we can really generalize stress, I think, and they'll say, you know, my job is stressful, or home life is stressful. It's like, well, let's like quantify that a little bit more. Because I think it is normalized in our culture really to be pretty stressed and frazzled. And so a lot of times people don't even know that they're really not breathing, you know, not really getting deep breaths, because when we're in that frazzled state, back to the kind of fight or flight physiology of the nervous system, it's not one where we're, you know, really sitting, tuning in, taking deep breaths. That's why I love to have people kind of tune into that, and then think about consciously doing some breathing practices and figuring out other ways to slow down maybe taking some things off the plate.
Yeah, definitely. So I wanted to actually talk about that before we end. I think we could go into that a little bit and talk about a really good way to sort of do this piece that we're talking about. And so I just encourage you, next time you feel that shortness of breath, that air hunger, you start to come up, if you can, it's best to just sit or lie down at that point. And to notice sort of just closing your eyes and noticing sort of your mental or emotional state. Like, what are you thinking about? What are you, is there a worry? A lot of times these things come up when we have guilt or fear, like really strong emotions. So that'll help you give awareness in the moment so that you can sort of address those things, not in that moment necessarily, but you have the awareness for that when you're ready to address those things. And then practicing deep breathing. And I want to be very specific on how I share this. And it's named many different things. You can think of it as diaphragmatic breathing or 3-part breath if you're more into the yoga realm, but it's really about getting deep, complete breaths. And so after you sit down and just sort of gather yourself, starting to take deeper, slower, fuller exhales, excuse me, and then from there, taking a deep inhale. And what we want to think about when we're inhaling is to actually think of the expansion happening. So it starts from your lower belly, just below the belly button. That part of your belly should almost come outward. And then you want to think of the second part as your rib cage expanding out, and then the chest rising. So a lot of times when we have shortness of breath, right, we're just shallowly breathing in our chest. So I want you to think of breathing lower. And then also is when to fill deeper into the lower part of the lungs. So it's just, for some of you, that visual might help. And then what happens there too is that the diaphragm flattens out and allows you to get a deeper inhale. So that's why we talk about the rib cage expanding and why we call it diaphragmatic breathing. So there's more space for you to breathe deeper into the lungs, get a fuller breath, and that's going to allow a fuller exhale, and is sort of, they kind of play off of each other, if you will. So we talk about box breathing too. So if that helps you, thinking of, you know, inhaling for 4, holding the breath a little bit, then for 4, and then exhaling for 4, and then holding the breath out for 4 counts. And you can play with those numbers to what it feels like for you. Maybe it just starts out, you know, with 3 seconds, just kind of notice what works for you. But having that, holding the breath even a little bit and holding the breath out, that cycle could be really, really helpful for calming you down in the state and allowing you to get that oxygenation happening.
Love that. So I think that gives everybody something practical to go try next time you find yourself experiencing this. Angela has a wonderful meditation album where she guides us through these really blissful meditations and mindful moments. If you do need a little bit more support on the breathing front on an ongoing basis, check that out. It'll be linked in the show notes here, but that's a wonderful resource if you do prefer a little bit of guidance. I know I certainly do, because my mind wanders too much, tends to wander a lot when I try to get started on my own, especially if I'm already a little bit anxious. I find it difficult to stay with it. So I love having your guidance, Angela, always in my back pocket.
Thanks.
And Dr. Holly, thank you so much for sharing your wisdom. And I think that really will tie a lot of connections together for our community. And we're so grateful that you were here today and to have you on the show.
It's great to be here. It's always good chatting with you ladies.
And we'll definitely have you back soon.
Thanks.
Okay, thanks everyone.
Bye, Dr. Holly. Thank you. Bye, everybody.
Thank you.